So in this lecture, we're going to be discussing surveillance. Yeah, just an introduction to surveillance, which is a very important aspect in public health. So in terms of just a recap on the definition of public health, what is public health? Public health can be defined as an approach to health that aims to improve the health of the entire nation. By public health, we are not really focusing on individuals. So in public health, we are focusing on the entire population when we are implementing our health initiatives. This is the way in which health systems monitors, analyze, and draws conclusions about health, about health concerns. So at public health level, as mentioned, you'll be looking at population level as opposed to really looking at individual level. The counterpart of public health is the clinical medicine. And the clinical medicine now, that's where you really see patient by patient, where you've got individualized care depending on whatever the condition they have. But for public health, you're looking at this as a patient. What are some of the things which can pose threat to public health? There are a lot of these. You can have infectious disease outbreaks, things like influenza virus, the coronavirus, the Ebola virus. You can have chronic illness. Also, these are becoming a very serious concern within our setting. Non-communicable diseases like heart disease, cancer, or diabetes. You can also have environmental disasters, things like hurricanes, tornadoes, earthquake, cyclone Idai, which happened within our country, where a lot of families and households were destroyed. You can also have public health threats coming from biological or chemical terrorism. This is not very common in our setting, but it is very common in some of these countries where we talk of biological warfare. So all those things, actually, they can be threats to the public health. And as part of really implementing public health initiatives, measures needs to be put in place to make sure you prevent the public from being affected by some of those threats. Then coming to our talk in terms of what is public health surveillance now. Public health surveillance is the ongoing systematic collection, analysis, and interpretation of health data, essential to the planning, implementation, and evaluation of public health practice, closely integrated with the timely dissemination to those who need to know. So this is a simple definition here, if you look into it in the way it is structured actually. To those, I think some of you appreciate the whole process of research. So in terms of research, and in terms of, it's not like really you are researching, but the concept of research is, you collect data, you analyze data, you interpret that data. Then you use that data and in case of public health surveillance now, you then use that data to planning, implementation, and evaluation of public health practice. At the same time, you need then to make sure you disseminate that information to those who need to know and those who need really to use that information. So surveillance, it provides information for descriptive epidemiology. Remember our descriptive epidemiology from our first lectures in epidemiology. Descriptive epidemiology, actually we are dealing with place, person, and time. So in terms of person, we want to see who is affected in terms of their age, in terms of their sex, in terms of their race, in terms of their social status, in terms of their level of education, and many other things which really describe the person. Then in terms of place, is where, this is mainly geographic. Then in terms of time, it's about dates, hours, days, months, or year. Some of the conditions can be seasonal, so you need to really know at which time of the year people are being affected. Just a recap again on the definition to say, what are some of the key words in this definition of surveillance? How, and that's the ongoing, and it has to be an ongoing process. You have to do it and it's routinely and it's ongoing. And as you do it systematically. And by systematically, we mean you need to do it in an orderly manner. So you don't just do it, as a way of doing it, but you need to make sure as you do it, you need to do it in an orderly manner. And what do you be really doing? That's the collection, analysis, interpretation, and dissemination of health-related data. And why do you do it? We do it so that that data can be used for public health action so as to reduce morbidity and mortality, at the same time improving the health of the population. Who performs public health surveillance? There are so many people here who are involved in performing public health surveillance. We can have your epidemiologists, you can have your medical professionals, your doctors, your nurses, your clinics, pharmacies. So within the pharmacies, there's a lot happens in terms of really, the drugs. So yes, in terms of health insurance providers, they need to know which are the common conditions and which are happening, which people are being diagnosed. They also release this, for their actuarial calculations in terms of releasing costs and some of the things. Then emergency responders, those working in emergency departments, public health departments, local, state, federal, at the regional and at the regional level. In our case, we talk of clinic level, we talk of province, we talk of district, we talk of national. So all these people actually, they are really involved in performing public health surveillance. So public health surveillance is not like a one-man job or a one-man task, but this can be performed by many other people who are really involved in offering health service at various levels and at various stages. Why do we do public health surveillance? Because it estimates the size of a health problem, and we need to know magnitude, and it determine where an illness is occurring geographically, portray the natural history of a disease. So if you're not really monitoring, we won't be able to really understand how the disease is progressing. But if you are really checking the disease stage by stage, we'll be really able to see the natural history of this disease, which is how does the disease progress from infection up to what, and up to death, So that's the natural history. It can also help us to detect epidemics. So I think we've had the current issue about the corona, where countries are really blaming each other in terms of really, have you been, in terms of systems which were put in place to try and prevent some of these epidemics. So it also helps to define a problem. Surveillance is also key in generating hypotheses in research. Remember, as I mentioned from the first slides, when I said surveillance, public health surveillance, it really focuses on the descriptive, aspects of epidemiology, where we discuss who is affected, where are they affected, what time are they affected. Using those information, we can actually generate research hypotheses, which we can then really use to test further, to really see actually who is affected, which is a further stage in the research where we are now doing analytic epidemiology. We can also use it to monitor changes in infectious agents, to detect changes in health practice, and to facilitate emergence planning. So if you then look in this whole process now, as I mentioned, to see from the definition, if you look at it, it's more of like a cycle. So you have a cycle, and this is what we call the surveillance cycle. So for a surveillance cycle, what is the first step of this? We need to diagnose or detect. We need to diagnose or detect whatever condition or whatever health event which we are looking into. Then after detecting that health event, and we then need to put in place reporting or data collection systems for whatever health events or which we will be looking into. Then from there, we need to do analysis now. We now have our data, we analyze data, we interpret that data. We then communicate this information to those who really need to use that information. They might be policymakers, the healthcare workers, even the patients. They might need to know some of this. So we communicate this information to them. After communicating this information, there's action, and there's people need to really to action, so that they address whatever challenges which might be coming from the data, whatever issues which might be coming. Then at the end of the day, you need to evaluate how we are doing. And then So evaluation is very important. It's very key as part of surveillance, because you need to really know in terms of, are you doing the proper thing? Are you collecting, is the system performing what is intended to perform? So it is very critical to understand this. The surveillance, the whole surveillance, it can actually be converted into a surveillance cycle, which is these stages which I have mentioned. Then, just taking this whole issue of surveillance to international level, we have what we call international health regulations. So these were like really published by the World Health Organization around 2005. Around 2005, that's when the first book was published. So these actually international health regulations. These are systems which are put at international level to make sure they are surveillance and its system. So in terms of what are these international health regulations, in terms of what are these international health regulations, there is agreement between all the WHO member states to work together for global health security. Countries, they agree to strengthen their capacities to detect, assess, and report public health events so that they meet international standards. International health and regulations, they include specific measures at seaports, airports, ground crossings to limit the process of health risks to neighboring countries. So I think that's the whole. If you want to read more about these international health regulations, it's just a surveillance system, and which has been pushed at international level to make sure that countries, they really work together in trying to address some of these countries. A good example which we have these days is this coronavirus, and where actually there's restriction in travel between countries to countries. When people are really visiting other countries, there are these issues of quarantining and so many issues. And I think you've heard the debate between the United States and China, where the United States is blaming China, for creating the virus, not really letting the World Health Organization know in time about the virus and all those issues, and issues to do with the World Health Organization now trying to pull out of the WHO. Why? It's because of all these issues to do with international health regulations. Because if countries don't work together, then there's danger and risk of really diseases and spreading. So the whole issue is surveillance is more, and it can really go at a higher level, where we are talking of relations between countries, as opposed to really surveillance which happened at country level. If you look at the recommended the World Health Organization schema for flow of communication and surveillance, these are the various levels actually, and which are expected to in terms of the level. So the lowest level, which we really expect, we need to make sure there are surveillance systems and at local level, at clinic level. Then from the clinic level, you need to have systems where we are collecting health data of common health conditions, and you are collecting data from there at local level, from clinic level. Then clinic, they feed into districts. Then from districts, they feed in our setting, they feed into province level. Then from our province, we have your central level. And if you know, in terms of our system, we have a lot of systems which are used really for collecting various diseases. But the common system which is really used for collecting health data, we have got the T series, and I think some of you might have worked within the health system, where we talk of the T1, T2, whatever, up to T, whatever. I mean, up to I think it goes up to T12, whatever, in terms of those sheets which are available at health and at clinic level. Using these T series actually, they are of sheets. Information is collected at primary level, sent to district where it is consolidated, sent again to province where it's collected, and finally to national level. And every week, within the Ministry of Health, within our setting, I think it's the Department of Epidemiology and Disease Control, They release a weekly bulletin, and it's where they are reporting, like a surveillance, really reporting the number of cases of various disease, mainly the infectious disease, number of cholera cases, number of cholera cases, number of typhoid, number of dog bites, and many other conditions and which affect. Then nations and countries, they also send information to who now, and this is where the World Health Organization, they release a weekly epidemiological record or a bulletin where they are giving information in terms of what, and in terms of statistics. These days, if you look like for the coronavirus, and I think it's more of like a daily bulletin which is generated at various levels. So this is like really some system which is expected in terms of disease surveillance. Where do you get public health surveillance data? There are several sources where we can get public health surveillance data, depending on the disease or the health event which will be which you want to survey, to have a surveillance system. You can get this information from vital records. These are hospital records, the death certificate, birth records. You can conduct surveys. Some of the surveillance things, actually, they might need to be done actually by conducting research. And how do you conduct these surveys? You can conduct surveys in schools. They can be conducted among doctors and among insurance companies. You also have other surveillance systems which are put in place, like when you want to monitor water quality or air quality. There are systems which are put in place so that these environmental issues, they are monitored. You also need to monitor. Remember, these days we talk of One Health. By One Health, we are really trying to link, the issues to do with animal and issues to do with humans, because there's this interface between animals and human. And because of that, you need to make sure there's understanding, there's collaboration and understanding of what's happening within either side, because there's so many diseases which you call zoonosis diseases, which actually emanate from animals. So there are also systems which needs to be put in place. These can also be sources of data, where you can collect data from veterinarians, from farms, from food manufacturing. So in terms of really surveillance, there's so many systems which can be used. Let's take, for example, remember, in terms of our public health, in terms of our data, it's not only disease, but it's a health events. You can have, let's say, for occupational injuries and within the industry, we have got systems which have been put in place to collect occupational injuries, and within our setting, we've got the National Social Security Authority, NASA, and they write reports. They write reports. They publish, annual reports, really detailing, surveillance systems in terms of the common injuries, the common accidents which are happening. And if you go to most of the companies, they have, a systems which they use to collect injuries. I think you see this dashboard, in most companies, where they are writing on all those issues to do with occupational injuries. Our public health surveillance data collected. So in terms of how really public health data are collected, you can have what we call voluntary reporting, where individual persons, a doctor, or a hospital, they report the information. You have media, reports where they report on these, some of these issues, or you can have, some of the unusual health occurrences being reported mainly by the media. You can also have this information collected through public health initiated surveys. Let's say you've got an issue under concern which you want to really understand. So you can actually conduct a survey, either a telephonic survey where you conduct people to understand what is there, or you can send them forms by mail, which they can reply and send back, or you can check, public records. But these days, in terms of surveys, there's a lot now which is happening, where people are now using, the internet to really, there are web-based surveys which are conducted as a way of trying to assess the surveillance. So yes, these are the two main ways in which public health data is collected, either voluntary or by public health initiated surveys. Then you can also have what we call mandatory reporting, and this is very common. This is very common where some diseases actually are supposed to be reported. So some diseases are required to be reported to the local, state, or to the health departments. We have what we call reportable diseases or notifiable diseases. So within our setting, there are conditions which are supposed to be reported, reported. Some of those conditions, we have got, most of them, they are highly communicable diseases. Things like chickenpox, things like TB, things like measles. Those are notifiable diseases within our settings. So reportable diseases is the same as notifiable diseases. Diseases with high motility and high morbidity and mortality, things like Ebola and virus, they are notifiable disease. Then we have with diseases of strong public health interest. These are also supposed to be to be reported. So in terms of how these things are collected, some can be really mandatory depending on their public health importance. And the public health, their importance is defined by mainly those three criteria, where they're highly communicable. If you don't report, it means more people will be affected. Then in terms of morbidity and mortality, some of those diseases with high death rates, so they need to be reported very, very fast and very early. Then what are the types of surveillance system which we have? We have three main types of surveillance systems and which we can have. We can have, I think we've discussed some of these things up in terms of how we collect data without really putting this definition. But in terms of public health surveillance types, we have got three. We have got a passive surveillance system, we have an active surveillance system, and we have got syndromic surveillance system. In terms of passive is more of like really people, they are not really being forced to report. They are just reporting voluntarily and without really being forced by the local or Ministry of Health to report some of those things. For example, laboratories, physicians, or others, they regularly report cases of disease or death to the local, state, or health department. So it's more of like you as a healthcare worker, you see this thing is important. What do? You just make sure on a regular basis, if you find whatever needs to be reported, you report to the state. So these are examples of passive surveillance where a doctor can just report cases of measles if the doctor come across cases of measles, they then report those cases. Maybe a nurse's home can report an usual number of all the patients dying with whatever condition they might be dying from. Then we have got active surveillance now. By active surveillance, the Ministry of Health or the local state health departments, they put in systems and to make sure the laboratories, the physician, the healthcare providers, or the general population, they report cases of whatever health events. So in this case, it just means there are systems which have been, it is the authorities which initiates this whole process of reporting. They put in systems to make sure people they report. So in terms of accuracy, if you are comparing in terms of completeness, how many people are reporting, and in terms of accuracy, you realize that active surveillance, it achieves more complete and accurate reporting than passive surveillance. So yeah, so that's the difference between active. The ministry, the local authorities, they're actually putting a push to make sure that they're actually putting a push to make sure people and to make sure laboratories, physicians, healthcare, even the population, they report. Then in terms of another type of surveillance, we have got what we call or syndromic surveillance. Syndromic surveillance, this is the ongoing systematic collection, analysis, and application of real-time indicators for disease that allow for detection before public health authorities, that allows for detection. So in syndromic, we are not like really looking at individual level. And we are reporting data not at individual level, but we are what can I say, a good example? Maybe I can give an example of consolidated. We are reporting data is consolidated. We are targeting really syndromes. And one of the common syndromic surveillance system is the influenza, and it is the influenza, the influenza-like illnesses. There's so many things which causes, which really causes, which appear, and there are so many viruses which causes influenza. You've got your corona, you've got your influenza virus, you've got your maybe many other viruses, but all of them, they present with the same set of symptoms, which becomes a syndrome. So in terms of that now, we'll be really reporting on that. As we see a peak now, if you see a peak in this, in whatever syndrome, it can actually then allows us then to really move quickly and try to then check what exactly is causing this and this syndromic. The other common syndromic surveillance system, I think, is for measles and rubella, all those things, and all of them, they cause a rash. So because of that, actually, so there are a lot of these, syndromic STIs. They also have syndromic system. Then another good example, we are just looking at hospital, the number of patients being admitted. And if you see an increase in the number of patients being admitted, it then prompts you now to check now and to do a further analysis to really see, and with these people which are being admitted, they are being admitted for what, and which is like a further analysis, going deeper into, based on, remember, they're like indicators, they're like warning, and they then allow, they then prompt public health authorities to put in place systems to measure. Then in terms of, then the next thing we need to discuss now is planning a surveillance system. What are some of the things which you need to put in place when you're putting in place a surveillance system? First thing, we need to have clear objectives. And why do you want this surveillance system? What do you want to monitor? And what are the health events or diseases you are interested in monitoring that surveillance system? So your objectives are very clear. Then for you to be able to count the things, and for you to be able to count things and report data on whatever you are reporting, you need to have very clear case definitions, and where you are describing, where you have got very clear case definitions of what you'll be defining. I think we discussed this when we were discussing measures of disease frequency, where we say you then need to have proper, and you need to have proper case definition of what you're counting. If you don't have a correct case definition, then it means whatever you're collecting might not be enough. You might be over collecting, or you might be under collecting, depending on how you define your case definition. Then you need to be sure what are the data sources, where you're going to get the data for that surveillance system, and you need to put the data collection mechanisms. How are you going to collect the data? Where are you going to collect the data? You need to field test the methods before you implement, and you need to see if it really works. It's more of like pre-testing or piloting whatever you've put in you've put in place. Then what is important, as I said, as part of the surveillance cycle, you collect your data. You have what you want to collect, and it's very clear. You have case definitions. You collect your data. You analyze now on that data. That's where the issue of you need to develop and test analytic approach. If you have collected the data, how are you going to analyze what? How are you going to analyze the data? Is it going to be descriptive? Is it going to be analytic? And in terms of the methods and how you want to analyze. So that has to be very clear when you're planning surveillance systems. You need to be sure how you are going to analyze the data. Then after having your data, you need to have a mechanism. After analyzing data, you need to have a mechanism of disseminating now. But what is important, remember, we say it's part of surveillance. After you've done what you have done, you need then to have a clear mechanism of how you are going to disseminate your findings to people who need that information. So it is very critical to then have good dissemination, systems. How are you going to disseminate it? Are you going to call a meeting? Are you going to disseminate through the media? Are you going to use social media? And so all those things need to be very, very clear. Are you going to be writing reports? And after writing those reports, who are you going to send the reports to? So these are some of the things which are very clear when you are planning a surveillance system. Then just to go deeper in some of the things which are very critical, one of the most important aspects now of a surveillance system is a case definition. Because if you don't have a correct case definition, it means you will have issues in what you'll be collecting. Either you under-report or you over-report, or in terms of the correctness of what you'll be doing, there will be issues. So it is very clear to have a proper case definition for a surveillance system. So in terms of a case definition, what is the definition? A uniformly applied set of criteria for deciding whether to classify a person or a person as having a particular disease, injury, or other health-related condition. So it is very clear. It is very important to make sure you have got a uniform and a definition which you can actually use or apply, so that you in terms of your classification of who has a disease, who has an injury, or other health-related, so that you get accurate data. In terms of definitions, we have, in terms of case definitions, usually we have what we call a tiered approach to case definition. So in most cases, you tend to have, at the lower level, you have a suspect or a possible. Then from a suspect, you move to a probable. Then from a probable, you move to a confirmed. So usually, if you're looking at this, if you look at those arrows, in terms of accuracy now, a confirmed one, and it is more certain, you are more sure that what you are counting or what you are measuring, what your diagnosis is very correct. But in most cases, a confirmed case definition, that one, it will involve actually some lab tests, and let's say it's for corona. You can for corona, it has someone who needs to have a positive, but a suspect or a possible. Remember, as I said, corona can present with flu-like symptoms. Anyone who is presenting with flu-like symptoms, with a history of travel, blah, 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 all those issues, they're more like a suspect. But as they start showing the symptoms and they have a test which is now confirmed, it becomes a confirmed cases. Then in terms of inclusiveness now, inclusiveness, here we are trying to say whether are you missing or you're not missing. So usually a suspect case definition is more inclusive, which means it is more false positives, and so it's more inclusive. But as you go up, when you have got your test, which is like a gold standard for whatever your diagnosis, you have true positives and you have got less false positives. So it's less inclusive. So usually, how these definitions are applied, you can read what is called the IDSR surveillance and for case definition. So this IDSR is a document actually, which is available within the World Health Organization, but there's another one which was developed for the Africa region, which actually lists case definition of the most common conditions which are part of the surveillance system. So in this IDSR surveillance, in this IDSR case definition guideline or book, you will see case definitions for cholera, for typhoid, for corona, and many other conditions, for TB. In terms of, if you are saying for TB, what is a suspect, what is a confirmed, what is a probable, and all those things, they are defined. But countries usually they modify some of those definitions to meet their local, to meet their, because some of these diseases, in terms of how they present, it's not always the same, but they differ with countries, to countries. Well, we now really discussed how we are supposed to, things which you need to do when you are setting up a surveillance system. One of the important aspects of surveillance system are the features of a surveillance system. What does an ideal and a typical surveillance system should look like? So the ideal is like the most perfect, the expected surveillance system. So in terms of these characteristics, these are some of the characteristics of a good surveillance system, of an ideal surveillance system. The first one, it has to be simple. And by simple, it means it must be understood at all levels by the healthcare workers, by the patients, and by the people who analyze the data. It has to be what? To be simple. It has to be, the second criteria, it must be timely. And it needs to do, you need to get information on a timely manner. I give, for example, these days we have got the surveillance system which is collecting information for coronavirus. It is very timely. Every day, the Ministry of Health, they try to make sure they release a bulletin describing, the number of cases diagnosed, all those things. So it has to be timely. Then it has to be representative, which means it mustn't, it's so in terms of representation, it just means it has to cover everything. And in terms of person, place, and in time, and in terms of place, person, and time. So it means whatever you then get from this surveillance system, it should reflect what is actually happening on the ground. So and that's the meaning of representative. It has to be sensitive. We're discussing about case definitions, and case definitions, in terms of probable case, confirmed case, and all those things. It has to be sensitive, which means it mustn't really miss some of the conditions, some of the conditions. What if it mustn't miss some of the cases which that system is identifying? It has to be flexible. It must have a strong predictive value. This one we'll discuss later. It must be acceptable both to the public and to the healthcare providers, and it must be cost effective. So at times you might be asked actually to evaluate a surveillance system, and you're evaluating a surveillance system. You're actually evaluating this surveillance system based on this criteria to assess if it is simple, is it timely, is it representative, is it flexible, is it acceptable, is it cost and effective. So just to repeat again, what are the specific purpose of public health surveillance system? To portray the pattern of health-related states and events. By so doing, you are assessing the public health status. You then trigger public health action. It helps to define public health priorities. It's also useful in evaluating So in terms of the purposes, as I said, surveillance system can be used for following types of outbreak, food poisoning, and you can pick those things actually if you've got very good surveillance system. Your cancer clusters, your health threats after a natural or man-made disaster. Usually after these disasters, earthquakes or cyclone, now there's issues to do with sanitation, issues to do with the way people are living. This then really increase the risk of people developing communicable diseases like cholera, among other issues. Then some of the infectious diseases which can be picked up by surveillance system include Ebola, malaria, influenza, and chronic health problems, obesity, cardiovascular disease, and asthma. There's this notion where people think surveillance systems, they're only for infectious disease. No, they are not only for infectious disease. They can actually be used to assess non-communicable disease. like obesity, cardiovascular disease, and and asthma. So I think that was my last slide in terms of public health surveillance. So we discussed the definition of public health surveillance, where we say it is a systematic, ongoing collection, analysis, and interpretation and of health related data, either for diseases or whatever outcome we'll be looking. You then disseminate this information so that it can be used by those who want to use it. And we discussed different types of surveillance system. We've got your active surveillance system, you have your passive surveillance system, you've got your syndromic surveillance surveillance system. We also discussed a bit of at international level, where we discussed international health regulation and its systems, where countries actually they're supposed to have systems to make sure they protect each other against this disease. So I think this is, in a nutshell, just an introduction to surveillance.